Hi guys, Dr. Corbin Pominville here. You're here because you're in pain and you haven't been able to solve it yet. We believe this is because you haven't found the root cause of your pain yet. Pain is our body's way of saying there's a problem here. So really all we have to do is find the actual structure that's being affected, and oftentimes this structure is something that's getting pinched, and that pinching causes pain. So I put together a little video to help you understand your pain a little more. It goes a little deeper into the potential causes of your pain and how we can fix them. I really hope this helps. Hi guys, Dr. Corbin Pominville here, back with our 5th anatomy series on hip pain. So I want to use this video to explain to you what's going on in your body and give you some answers as to why you might be having your hip pain. So first, let's go over what actually is causing this pain. Number one, repetitive activities at work. So something like a manual labor job, you could be having wear and tear on your joints, especially if you are not using proper form. That would be things such as a proper hip hinge, keeping the back in neutral, and that will allow your hips to take an even distribution of the weight. Number two could be repetitive sports, exercise, or other activities. So this could also cause wear and tear if the form is not correct. Usually your body can withstand quite a bit of force as long as your form is correct. But if it's not, then over time, the joints are going to wear down. Number three, a traumatic event. This would be pretty obvious. Could be a lifting injury, a car or bike crash, or a sports injury. Number four thing it could be, and this is very common, is improper posture. So a lot of times hip pain, especially when it lasts for a long time, is due to our everyday habits. So think about what you're doing all day: sitting, standing, walking. These are things that we don't think about often, but if we're not doing them correctly, utilizing the right muscles and making sure that the body is in balance, that is, using each side of the body equally, then that can cause problems in one side of the body or even in both. Another thing is too much sitting, and we'll get into that a little bit more, but too much sitting can be very bad for your hips. So let's get into the anatomy here. There are 3 anatomical reasons why you may have hip pain. Number one, the muscles may be tight. This could be in your hips, of course, in your back, or even in the ankle, causing the hip pain. So back to sitting. Sitting too much can cause the muscles around your hips to tighten and shorten over time. And that's because they're in a shortened position when you're sitting, and that can cause them to kind of stay that way. If they're in a shortened position when you're sitting and then you go to stand up and walk around, now those muscles are so tight that they're pulling your joint and kind of compressing it into the capsule too much. And that can cause pain and wear and tear on that joint. Some muscles that can be tight here. So let's get a little closer look here. The glute med can commonly be tight. See, this is right around the hip joint. Also the IT band in here. These little muscles as well, you may have heard of the piriformis. Those can be tight as well. And then if you come up front here, you could be tight in your hip flexors. Let's see if I can get a little deeper here. So the hip flexors are right here, and they are kind of right around the hip. If they are tight, they can pull you into a position where your hip is going to hurt. So you don't want these to be tight, especially. Those are big. And I mentioned the ankle. If the ankle isn't moving, this can actually cause the hip to hurt as well. Or if one ankle is weaker than the other, say this ankle down here is weaker, then that could make you actually use the other side of your body more. And that can cause pain, even up in the hips. Something like the ankle not working on this side, not moving enough, could make you end up using the muscles around the hips too much and make the hip hurt. So number two, the bones may be too stiff or tight. This is an easier fix. What we do is we use mobilization techniques to loosen things up in there. So if we go right down to just the bones, but then we add the connective tissue, Most of your joints in your body, actually all of your joints in your body, are surrounded by connective tissue. And if this connective tissue gets too thick or tight, that can cause compression in the joint, and that can cause pain. So that would be something that we would check out as well. And muscles may be weak or not activating properly. That's number 3. So if the bones are not held in proper alignment, that can cause pain because they're shifting around too much. So you have your 2 sides of your pelvis here, which are connected to your hips, right? If one of these is rotating too much and they're rotating out of alignment, say one of them rotates forward, now everything's out of line, and that can cause pain in the hips. It can even cause pain in your SI joint right here. So both of those are kind of connected quite a bit. Also, if the glute med is not working, so let's add some muscle back here. Here's the glute med. So what this muscle does is this muscle helps keep the hips even this way. So it makes sure that one side of the hip doesn't fall lower than the other side. If one side falls lower, then we could be overusing one side, and that can cause pain. The third muscle that may be weak here is the core. So the core is on this side. It's a little deeper. Right here is the core. If the core is not holding your back, because the core wraps all the way around, if it's not holding your back bones, your spine in proper alignment here, and the spine is too loose, that can cause the area of the body next to it, which would be your hips, to be tight. So something even up here can cause something down here to hurt. Now it's important to understand that we do have 2 different types of people. Number 1 is a generally tighter person. Number 2 is a generally weaker and looser person. So what we need to do is figure out if you need stability or flexibility. Most likely it's a combination of both of these things. Generally people seem to lean towards one side or the other though. You may need flexibility in one area and stability in another area. So it's important to understand that everyone is different. Your hip pain may be due to different things than someone else's hip pain. The way we should treat your hip pain is usually unique to how we treat someone else's hip pain. This is why I can't give you an exact formula right now on how to solve your pain without evaluating you. So as you guys know, Better Life Health and Wellness specializes in hip pain. We've seen a lot of hips over the years. Right now, we are running a free total body diagnostic visit where we'll look at your whole body as well as take an in-depth look right at the hip. But as we explained, pain in the hip could be coming from somewhere next to it, not necessarily right in the hip. So we need to look at the whole body. And after we do that, we then use hands-on techniques to decrease your pain and loosen you up in the areas that need to be loose. And then we use muscle activation techniques to stabilize you and keep you that way, in that position. So feel free to message us on social media. You can text or call us. You can submit a contact form on the website. We're here to help. Any questions at all, send them over. Again, I'm Dr. Corbin Pominville, and thank you for tuning in.